you see everyone around you getting pregnant easily, and it's so challenging, I think, especially as a woman. Just your body, you feel like your body should naturally be doing this, and it's not month after month after month.
I'm having pain every month. Something is wrong. We are not able to conceive. We've been trying.
Yeah, there's a risk each time of a miscarriage, but like 4 in a row, that just seemed like wild to us. So we were like, we know there's still something that we're missing.
Being infertile and having a certain condition that I have, it felt extremely lonely. It felt like nobody understood my condition and what I was going through. That felt like there were no answers out there.
Eventually, I had a referral to a fertility specialist who told me, everything looks bad. Your ovaries are bad, your eggs are bad, and you don't have time to wait. You need to do IVF now if you want a chance at ever having a baby.
I think Veritas Fertility and Surgery is a very different and unique type of fertility clinic. And I think that our patients appreciate that, and they actually see the difference, especially for those of our patients who have seen an IVF specialist, for example, and they've gotten their this is how we go through the process, this is how we go through our protocols, and this is ultimately where you're going to end up, which is doing in vitro fertilization. When our patients are coming to see us, they're looking for a different approach. They're looking for answers. We're going to get down to the root issue. And that is very different from what most fertility clinics have. So there truly is no one-size-fits-all approach here at Veritas. Each patient is unique, and each patient deserves a specialized, tailored treatment approach.
There are treatments that we offer here at Veritas that are definitely not standard treatments offered by traditional reproductive endocrinology or IVF clinics. Some of these include advanced tubal surgeries, whether that's an office procedure where we can reopen blocked fallopian tubes, or more advanced surgical techniques like reversing a tubal ligation, advanced ovarian surgeries, reconstructing uterine defects, restoring normal pelvic anatomy with other techniques. These practices are unique to the restorative reproductive medicine world and definitely are one of the strengths here at Veritas.
We treat everything from uterine issues to ovulation defects to pelvic issues like endometriosis or pelvic scar tissue from prior surgeries. So across the gamut, everything or anything that could potentially be an impediment to healthy, natural, spontaneous conception or fertility, we have a treatment for.
I like that we have such an individualized approach to the way we approach patient care. It's not a one-size-fits-all, that each individual who comes into this office has a different story, and we take into account everyone's history and truly listen to the patient to understand where they're coming from, what their needs are, so that we can best address everything appropriately and meet whatever their needs are.
Dr. Putoff really listens and takes into consideration how you're feeling with treatments, and it's doesn't feel like an assembly line at Veritas. And you really do kind of learn the why behind why you're not able to get pregnant on your own, and Dr. Putoff and his team go above and beyond to get you that information.
Me and my husband, we wanted to have kids on our own, and that's what we believe, that we wanted to be able to conceive naturally, and we did a lot of tests and tried to figure out why I couldn't have kids on my own, and it was all related to my polycystic ovary and endometriosis.
We knew whenever we first started having struggles or problems, issues, that we didn't want to go down the road of like IVF or anything. And I knew that was something that I didn't want to do. And I know that at Veritas, they really strive to work to find the root so people don't have to go down that path. And that was the case for us.
With our approach, when we identify the underlying cause of infertility, then we can offer targeted treatments that really improve our outcomes and can help a couple restore their natural fertility and experience ongoing fertility on their own without the use of IVF or IUI.
Veritas is a highly collaborative practice, and us as nurse practitioners work as an extension of our physicians. I'm passionate about the work here at Veritas because after my own experience of endometriosis and infertility, I feel called to help others in that care as well. I'm very honored to be able to take care of patients as they entrust us going through that care.
Something my patients tell me frequently that they really love about our care is the personalized approach. they'll come to me and say, wow, this is the first time that anyone has even looked into this as a possible cause or even suggested this as a possible treatment. Why has no one told me this before?
We kind of joke in my family that my parents are grandparents because of the clinic at Veritas. So my sister has 2 beautiful children because of Veritas. We are so fortunate that we were expecting our first child because of Veritas and Dr. Putoff. So
I have nothing but just amazing things to say about this place. Just everybody we've been able to interact with.
I always tell him that he is our hero. He is the reason that I have my son. He's the reason that I'm about to have a daughter.
When I started Veritas Fertility and Surgery in 2021, I had this vision. I really wanted to create a practice that would be able to offer patients the highest level of personalized and compassionate care, whether it was for infertility, for recurrent miscarriages, or for other gynecologic issues. And I think all of our patients who walk through the door end up really experiencing what this is that we offer. We've had patients say time and again, this is very different from another type of clinic that I've been at. This is very different from the care that I've received in the past. They get the sense that we really want to offer them this concierge level of personalized care, that there is no one-size-fits-all approach at Veritas. And truly, with the team that we've created to provide this type of personalized care, we really feel that every single patient at Veritas is VIP.
My name's Mary.
My name's Grace.
My name's Leah.
I am Almira.
My name is Marianne.
I'm the mother of 1 and 1 on the way.
My husband and I are expecting our first child in September.
And I am expecting my first child due next month.
This is my daughter Rosemary. This is my son Thomas.
And we have a baby sister on the way.
Thanks to the
Thanks to the team of Veritas.